Hi, I'm Priya and this is part 2 of statins, who should take them. In the previous video we saw how LDL cholesterol influences cardiovascular disease and how statins can prevent cholesterol from forming. In this video we will focus on who should and should not be taking statins, are they safe, and are there any alternative medications. So who should be taking statins? Statins should be taken by people who have a high risk of developing cardiovascular disease. The National Institute for Health and Care Excellence suggests statins should be taken by people who have a 10% or higher risk of developing cardiovascular disease in the next 10 years. Statins should be taken by people who have a very high LDL cholesterol level above 190 mg per deciliter. However, this figure may vary depending on different healthcare systems. People living with diabetes, have high cholesterol levels, or have a family history of cardiovascular disease may also be prescribed statins if they are unable to make lifestyle changes, or if they have made changes but this hasn't reduced their risk of cardiovascular disease. Additionally, individuals who currently have a cardiovascular disease should also take statins to prevent their risk from increasing. Statins are also used to treat a genetic condition called hypercholesterolemia, where individuals naturally produce high levels of cholesterol even in those with a relatively healthy lifestyle. So, who should not be taking statins? Statins are not recommended for people who have a healthy lifestyle and are unable to change their lifestyle to reduce cholesterol levels. Individuals with severe liver disease or an abnormally functioning liver should definitely not be taking statins. This is because statins are metabolized by the liver and can therefore affect its function. It's important to have a blood test and consult your doctor before taking statins. Statins should not be taken by pregnant women or any individuals who are at an increased risk of the side effects, such as those over the age of 70, individuals who smoke and drink excessive alcohol, people who have a history of liver disease or myopathy. If these restrictions apply, then individuals who are taking statins must be checked frequently by their doctor and their dosage may need to be changed. So why should statins be taken? Statins should be taken to reduce the risk of developing cardiovascular disease. Blood tests measure how much LDL cholesterol is present and doctors may need to reduce the dosage of statins accordingly. If an individual is making lifestyle changes and cholesterol is lowered, then statins may no longer be needed. Statins are usually taken for the rest of an individual's life depending on their risk, because when a person stops taking statins, their cholesterol level begins to increase and return back to normal, increasing their risk of developing cardiovascular disease. So, would statins really reduce the risk of cardiovascular disease? Yes, but lifestyle choices are important too. Statins reduce the risk of cardiovascular disease, but they do not eliminate or reduce that risk to 0%. High levels of LDL cholesterol is just one factor that contributes to cardiovascular disease. Others include diabetes, obesity, smoking, drinking alcohol, and inactivity. You may be wondering that even though people are at risk from cardiovascular disease, do they really need to take statins? The answer here is no. There are other ways to reduce cardiovascular disease, such as exercising and maintaining a healthy lifestyle. So are statins safe? Numerous studies have been completed which show that statins are safe to use. Nevertheless, they are not a substitute for making lifestyle changes to reduce cholesterol levels. It's important to remember statins do save lives and people do need to take them, which make them good drugs. However, the side effects of these drugs, such as muscle pain, can lower an individual's quality of life, making it difficult for them to exercise, which is counterproductive. There are advantages to taking statins, such as reducing the risk of cardiovascular disease, lowering cholesterol, reducing plaque formation in blood clots, and protection against sepsis. However, the disadvantages of taking statins are that the risk of cardiovascular disease is not removed, it is only reduced, meaning that the risk is still there. Statins also increase the risk of developing diabetes. They may need to be taken long term, and it's easy to become dependent on statins to reduce cholesterol instead of making changes to your lifestyle. There's also the increased risk of muscle damage caused by statins. Statins have been known to interfere with food, drinks, and other medications. When taking statins, individuals should not eat grapefruit or drink grapefruit juice because these stop statins from functioning. Alcohol intake must be monitored by a doctor because side effects could become worse. Certain medications also interfere with statins, such as verapamil, antibiotics and antifungal medication, and anti-epileptic drugs. It's important to discuss your medications with your doctor before taking statins. So are there any alternatives to statins? If your doctor doesn't prescribe statins, they may prescribe other drugs such as ezetimibe, which blocks cholesterol from being absorbed into the blood. Aspirin may also be prescribed to prevent blood clots. Other ways to reduce cholesterol include monitoring blood glucose levels by reducing sugar intake or losing weight. As mentioned earlier, exercise and a good healthy diet will also reduce cholesterol levels, as well as maintaining a healthy weight and reducing alcohol intake and smoking habits.